So we're going to look at estrogen first, whether it's in an oral contraceptive as a totally synthetic, or a Premarin, which is mare's urine extract, or a bioidentical hormone as part of either HR or just estrogen replacement therapy. Any of them, whether it's applied as a patch, taken orally, anytime you're introducing estrogen into the body from an exogenous source. So all estrogen supplements, oral and topical, are going to deplete 3 nutrients. And these 3 nutrients have many uses separately, but they're this unique combination together: magnesium, B6, and zinc. I'd almost kind of like you to just see that as a little bit of a rhyme: magnesium, B6, and zinc. Magnesium, B6, and zinc. In the next slide, I'm going to look at these and give you some of the reasons why I'm talking about them as a unit. Of course, we could talk about them individually, and I'll bring up some of that, but together as a unit, they are cofactors. And if you're missing one, it could be the difference between the cofactors doing their job and producing the next chain of events within the body as part of a production line. Now, we'll just vary this a little bit and look at oral contraceptives. And I'm looking at now the oral contraceptives that would contain estrogen, not just a synthetic progesterone, but one that are combinations and have estrogen. And so oral contraceptives with estrogen are going to expand this list beyond magnesium, B6, and zinc to the rest of the Bs. So vitamin B12, B1, B2, B3, folate, which is B9, vitamin C, and selenium. We're trying to find the ones that are significant, and this is extremely significant given that oral contraceptives are taken every day or at least 21 days out of a month, and they're taken long term. It should be automatic. When someone is on a birth control, they should at least have a multi. That would a good multi with good quality Bs. Note, estrogen increases the liver's ability to manufacture clotting factor. This is the mechanism by when I talked about birth control pills causing clots and actually deaths. It's not an uncommon thing, and it can happen to, let's say, a teenager who seems fairly healthy, be put on a birth control pill, and within that first month, they have these issues. Now, if a young girl's put on a birth control pill for managing her cycles, like getting them to be regular, doesn't necessarily mean that it reduces the cramping. Matter of fact, it most likely doesn't reduce the cramping. And the reason for that is it's depleting magnesium, B6, and zinc, the 3 cofactors needed to not produce prostaglandin 2s, which are the inflammatory prostaglandins. How I describe this is for female who coming to the end of their cycle, or the second half from ovulation to the period, they often have a lot of PMS symptoms. And there's 150 of them that are set up, and if we look into it, below them is inflammation. And you need and it's a specific type of inflammation. It's breast tenderness, it's tenderness in the whole abdominal area. Sometimes it even feels like everything's gonna fall out. It's just that type of everything's inflamed. That happens, that's the type of inflammation with prostaglandin 2s. And it's prevented if you have enough magnesium, B6, and zinc.